Hi, Mark Manning here with Medical Management Services in Columbus, Georgia. I'd like to talk with you for just a couple of minutes about the new LCDs that are sweeping the country. This pertains to epidural injections. And so this is really for pain management groups and anesthesia groups that provide anesthesia services for pain management groups or pain management physicians. Now, you need to really pay attention to the Medicare Carrier. Oh, that's my dog Gilligan that you hear, our chocolate lab Gilligan in the background. He likes to help me out on these videos sometimes. But you really want to pay attention to your state or your area, the Medicare contractor. For example, just using an example, Palmetto GBA. They're the Medicare A and B contractor for Alabama, Georgia, Tennessee, South Carolina, North Carolina, Virginia, and West Virginia. Now, their new LCD and LCA has already gone into effect for epidural injections. Now, from the pain management side, the surgeon side, there's 14 separate limitations that's in this LCD. So as the pain management provider, you really need to be familiar with this if you're not already. This LCD is already in effect. The LCD is L38994 for Palmetto GBA, and the LCA, which actually has the coding and the billing information in it, the LCA is A58695. Now, from an anesthesia perspective, if you're accustomed to being an anesthesia provider that's providing any type of anesthesia for these epidural injections for your pain management groups or clients, this is a key limitation here, number 4 in the LCD. It says use of moderate or deep sedation, general anesthesia, and monitored anesthesia care, or MAC, is usually unnecessary or rarely indicated for these procedures and therefore not considered medically reasonable and necessary. Even in patients with a needle phobia and anxiety, typical oral anxiolytics suffice. In exceptional and unique cases, documentation must clearly establish the need for such sedation in the specific patient. So your documentation requirements have gotten much more restrictive. Now, you might bill anesthesia for these still and get paid, but remember, Medicare can always do a post-payment review and take that money back. So if you're not already familiar with these new LCDs and LCAs that are in effect, I suggest that you get acquainted with them right away. As always, things are getting ratcheted down by different payers. The Medicare Advantage plans, the commercial payers who have policies in place for epidural injections and especially anesthesia provided for these epidural injections, more often than not, sooner or later, they will follow suit with what Medicare publishes. So give us a call if we can do anything for you. That's Mark Manning with Medical Management Services in Columbus, Georgia, 706-315-4660. Thanks, and y'all have a great day.